Welcome everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please be reminded that public health measures continue to be the most important protection to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water, or use an alcohol-based hand sanitizer, use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when attending commercial establishments. For area businesses, visit our website to access our Safe Return to Business Toolkit. I will now report our current case counts. There are 107,590 confirmed cases of COVID-19 in Canada and 36,723 cases in Ontario. Chatham-Kent has 166 cases, and Sarnia-Lambton has reported 286 cases. Michigan now has 69,338 cases, with 11,932 cases being in Detroit. Today, we are reporting 1,815 cases of COVID-19 in our community, an increase of 15 cases from yesterday. 10 are workers in the agri-farm sector, 3 are in the community, and 2 are under investigation. 1,187 cases have now resolved. 528 people are self-isolating. 26% of our cases are between the ages of 20 and 29. 24% are between the ages of 30 and 39, and 17% are between the ages of 40 and 49 years. 65% are male and 34% are female, with 1% unknown at this time. Our community has lost a total of 68 people to COVID. 49 deaths have occurred among residents in long-term care and retirement homes. There are 2 long-term care and retirement homes in COVID outbreak. In addition, there are 5 workplaces in the agriculture sector and 1 workplace in the manufacturing sector experiencing a COVID-19 outbreak. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, and shortness of breath. Call 911 if you have difficulty breathing and are struggling to breathe or speak, or are experiencing severe chest pain if you are feeling confused or losing consciousness. Please be reminded that Windsor-Essex has 2 COVID-19 assessment and testing centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital Ouellette campus. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. To check your results, please go to www.wechu.org and click on View Your Results to access the online test result portal. If you are unable to view your results, please contact the assessment center or provider that initiated your test for your results. The WeChu will call anyone who has a positive test result. Please continue to visit our website at wechu.org for the most current information and case counts. I will now turn it over to Dr. Ahmed, our Medical Officer of Health, for further updates.
Good morning, and thank you for joining us again. It has been about 4 months since the declaration of the COVID-19 pandemic and the beginning of public health measures, emergency orders, and lockdown. As we await further announcement from the Premier on Ontario's plan for Stage 3 reopening, we should consider key lessons learned from other areas of the country and the world. In some areas where broader reopening has proceeded, they are beginning to experience an increase in COVID-19 cases. We must continue to practice important public health measures. If residents remember these simple steps and keep them part of and integrate them into their daily living, we can continue to limit the spread of COVID-19 in our community. Maintaining physical distancing and avoiding large gathering is one of the most effective public health strategies in the fight against COVID-19. The more contacts each person has, the larger the potential for community spread of COVID-19. When you are out and in public, or places where in places where physical distancing cannot be maintained, wear a non-medical face mask to protect yourself and others. Avoid touching your eyes, nose, and mouth with unclean hands. This is a key way to introduce the virus into your system. Wash your hands often before eating, before touching your face, etc. Wash with soap and water for at least 15 seconds, ensuring that you lather and scrub each part of your hand. If you don't have access to soap and water, use an alcohol-based hand sanitizer. Also, clean and disinfect your home, your workstation, your car, and all the high-risk touch surfaces. For high-risk touch surfaces such as light switches or doorknobs, clean at least twice a day. Lastly, if you're sick or feeling unwell for any reason, stay home to protect yourself and others. The greatest challenge we face is not the virus itself. I think we have done a great job in containing the virus, but the constant misinformation that's being spread is extremely harmful for the community. We need to be absolutely clear in what public health measures help and what will help us to prevent the spread. Any misinformation or mistrust that is created will be detrimental for our community and lead to further spread of COVID-19 in our community. We all want to get to stage 3 and keep moving forward. We have done a great job in Windsor-Essex. Let's continue to do this great work. Thank you.
The conference is now unmuted.
We'll now take questions from the media. We'll start with CTV.
Yes, good morning, Doctor. You talked about phase 3, so let's talk about phase 3. Do you think this region's ready for that next step, considering that we just moved into stage 2 not too long ago?
So I think I can understand that people want to maybe move to stage 3, but what we are seeing is we need to use all the evidence that is available with us and to look for a consistent trend of decline in the rate of community cases. We also want to know what impact stage 2 reopening has in our region. So it is critical that we continue to follow the data since the reopening and feel more comfortable that despite all these additional places, workplaces that are open right now, we have the virus fairly contained in the community. The initial evidence points to that fact, but I think we still need to look at some of the data for a longer period of time to feel more confident in our system. But eventually the decision would lie with the province in terms of how and when they move us to stage 3. But locally, some of the key messages I think we still need to follow. We're still getting some complaints about these workplaces, restaurants and bars and patios. I think we really need to get a good handle on that, and we cannot do it unless we have the support from our residents. So we definitely want their support. We want them to follow the public health measures to keep the virus contained and the numbers low, and then that would give us good evidence and indication that we are ready to move to stage 3.
So do you like where the numbers are at then? Like, I mean, last week you talked about how you wanted to have a bigger sample size before we even start talking about phase 3, but you know, if he throws us into that loop today, are you still comfortable with the trend of the numbers and you know, moving us into phase 3?
Well, what we are seeing right now is very clear that our case counts are generally coming from the agri-farm sector. And the community spread we are seeing is fairly limited and pretty much comparable to some of the other places. But I think I would feel more comfortable when I see the trend continues. If it's a decision that has to be made today, that's a totally different conversation, but I'm not sure when that conversation will take place and what the direction from the province come down.
Okay, great, thank you.
Any questions from CBC?
None right now, thank you.
Any questions from Blackburn?
Just under your view, what is that time frame? How much data do you think we need before we can talk about, seriously talk about moving into phase 3, seeing that Leamington and Kingsville just moved into phase 2 this week?
So generally speaking, if I go with the evidence, 14 days the minimum timeline that we should be looking at, because that's the time the virus takes to incubate in any individual. So with the opening, whenever these openings are happening, we should take at least 14 days to see if the opening has an impact. But again, day one, when some things are open, not everyone is out there. So it may take like a week before people go out and maybe start to get together more. So at least 3 to 4 weeks of worth of data is a safe bet in my opinion, but the minimum, it has to be at least 14 days. The safest bet would be 3 to 4 weeks, and I know, purely from a public health perspective, maybe the longer term data could make sense, but recognizing that we are trying to balance the societal and economic harm to the community as well. So we need to use what we have learned in the last 4 months of following all those public health measures and to keep practicing it. That's the only way we can move forward. That's the only way we can contain the virus. And we still need to stick to what the evidence-based recommendations are and to avoid any misinformation that may come your way, and stick to some of the same measures that we've been practicing. It's not difficult. We just need to continue to do it as we move to stage 2 or stage 3.
Thank you.
Any questions from AM 800?
I'm not sure if this is for Teresa or Dr. Ahmed. Last Monday, you reported there were about 220 complaints since June 30th, since moving into stage 2. Do we know what the numbers are as of today?
This is Teresa. It's about 30 a day that we investigate, and it continues to be issues about patios, non-compliance with the distancing, and also the wearing of face masks.
Were there any issues this past weekend in Leamington and Kingsville? Was their first weekend for the patios? Were there any complaints in Leamington or Kingsville?
I don't have that information right now, but we will look into that and we can report that tomorrow.
Thank you.
Any questions from Windsor-Essex?
Dr. Ahmed, you mentioned misinformation as a serious threat to our containing of this pandemic. What types of misinformation would you say are the most harmful?
Well, I think as we are dealing with this pandemic right from the beginning, there's been information, and with due respect to some of the people who may have an opinion, and a lot of people have an opinion, and especially those who are not even a doctor, let alone a public health expert. It is absolutely important for them to understand their own limitations and recognize that they are doing a great disservice to the community if they continue to express their opinion, which may not be based on evidence or any of the public health expertise that is needed for that. Creating doubt and providing opinion and matters that people are not qualified, it could lead to behaviors in people and create confusion. And those behaviors could potentially lead to spread of the virus in the community, and that's very harmful. So I think it is important that we get our information from the right source. We get information from the people who are qualified and who have the expertise to make those recommendations and give those opinions. So it is absolutely critical that we follow those recommendations and follow those experts instead of following what makes a good news story.
Any questions from the Windsor Star?
Yes, good morning, Doctor. To go off of what Owen's asked, I'm just wondering if there are any specific pieces of misinformation that you're seeing out there that you want the public to know that's false and what you're saying is true. Any specific examples?
Well, I think there's been a lot of questions about face mask use and whether it's effective, whether it's not effective, even just the comments on that. And I think the scientific part, we can have a totally different discussion on the effectiveness of these masks, and depending on what kind of materials we're talking about, what kind of an impact it has. But when we're talking about a public health measure and a recommendation, it doesn't mean that what we are debating about the scientific efficacy of those masks. It's about a behavior that we want in the public that helps promote these safety for everyone in the community. The second piece of misinformation that people are thinking about, the virus, whether it's actually there, and we have seen some of the harms that are coming in from the south of the border when people are congregating in large numbers, and then getting into a situation where this is spreading so easily. The other misinformation about the testing itself, that testing, some people think that it's a prevention effort. It's not. Testing does not prevent anyone from contracting the disease. The public health measures that we've been talking about it every day, those are the measures that prevent it. Testing helps people who have symptoms or who are concerned that they are exposed to someone with COVID. So I think those are the key ones that we continue to address, and we need to take responsibility of our own action. We need to feel that this is the behavior that we need to work on. We need to change our behaviors and ensure that we are practicing physical distancing, we are hand washing all the time, as frequently and as often, and staying home when we are sick. Those are the critical measures that will help, and I think, as basic as it sounds, but those are the measures that brought us to where we are, and we can look across the world what is happening in other countries and how well Canada has done a great job in containing the virus spread. So those are the big ones that I can think, but there are little pieces of misinformation all the time there, and I think we need to be really careful in who we are listening to and who's providing that opinion.
Thank you, Doctor.
Any further questions from CTV,
I'm good for today, thank you.
BBC,
No, thank you.
Blackburn,
No, thanks.
AM 800?
Dr. Ahmed, just following up to Bob and Maureen's question right off the bat. So when it comes to stage 3, I believe in stage 2, the province was asking yourself and other medical officers of health for recommendations. Were you a part of this process? Did you give a recommendation for stage 3?
So at this point, it's what I was part of. It's a preliminary conversation of what it means and how the province is looking at the data. So those are the conversations that I've been part of. And from the looks of it, just the timing and the data that we need to make an informed decision. I think those were the conversation that we had, and at this stage, I guess that question was not posed to me about Windsor-Essex, if it's ready or if I'm making a recommendation to move Windsor support the province decision. So that conversation hasn't happened yet. It will happen in the future, I'm sure, but I think that's why it is also important for us to be mindful of what would work and how we can move to stage 3 and to get back to more of these reopening and get back to more of our normal life that we were used to. So I think it is why it is important that we continue to use the same public health message and continue to follow the public health evidence-based recommendations and do our part in containing the virus spread.
So if the Premier called you today, after we're done here, for example, before his news conference, and he asks for your recommendation, is it safe to say you don't feel Windsor-Essex is ready to move to stage 3? Going back to your further points, you're looking for that more data?
Well, I think it would be a surprise because even from the previous reopening, I never got a call from the Premier office, but again, from my public health colleagues in the province. But I guess the bottom line is the province basically ask us that how are we interpreting the data, what we are seeing here, and then they express their own interpretation of the data, and then we try to see if our interpretation and provincial interpretation are on the same page or if there's any more context that we need to add. Even when the previous conversation was focused on what does it mean when we are taking or when we are excluding the agri-farm sector from our local data, and what is the risk to the community? That's the most important part that we wanted to highlight. The second important part was what is happening to the rest of the community. So when we presented our data on Friday, it does touch on the different regions where these cases are in the last 7 days, in the last 30 days, and overall. So I think that's based on that, we see that most of these activities happening in the agri-farm sector, and the rest of the region is fairly comparable to the rest of the province. But we are all together, so I think we need to use those numbers, we need to look those numbers carefully and make appropriate interpretation before we move forward to stage 3.
Thank you. Appreciate you answering those last 2 questions.
Thank you.
Any further questions from Windsorite?
No, thank you.
Windsor Star?
Yes, Doctor. Just one more. You mentioned the United States a few times today. I'm just wondering if you can comment on your thoughts on what you're seeing going on there, large gatherings, people strongly opposed to mask wearing and things like that.
Yeah, and again, no disrespect to my fellow countrymen in U.S. I think it is a challenge. When I'm looking at their number, it is scary. It scares me. My friends, my family, they also live in U.S. and what they're experiencing right now is probably what we were trying to prevent from the first place. And as much as we can understand the importance of economy, the importance of social well-being, we understand that, but we also need to find that right balance where we cannot put the economy and social well-being in front of our physical physical well-being. So I think that's why it is important that many people in U.S. may not even understand how this virus is spread, and there is still some doubts that maybe it's some kind of a conspiracy and something else is going on, and the mask probably is another ploy for something else. So I think there's a lot of misinformation out there, and we really need to be focused on what our end goal is and what works and what doesn't work. So I think it is important that we continue to fight this misinformation. And since the beginning of this pandemic, public health has been struggling with all this misinformation out there, and even with the opinion of many of the experts that may not necessarily be based on public health science, and maybe based on their personal opinions. And we have to be careful how these opinions matter and what kind of a harm it can do if it's not even doing any good. It can create those harm, and we need to be careful that we are listening to the right people, we are listening to the right experts, and following the right recommendations from those experts.
Thank you so much.
Thank you, everyone.
Thank you.